Sheehy is going to be recognized next. One of our colleagues was kind enough to allow him to go instead because he presides at the Senate at 11 o'clock. Senator Sheehy, welcome to this committee. Well, thank you for your service to the country, and you're recognized.
Thank you, Chairman. Congressman, thank you for being here. Thanks for bringing your family. It's great to see them all here. As we know, the military is a family business. When we leave for months or years on end, it's them that carries the weight. I come from a very large state, not a whole lot of people, and a lot of our veterans have to travel many, many hours to get to VA care. And to that end, I'd be curious to hear your thoughts on how we are going to actually expand access to community care. Because as Senator Blumenthal and others discussed, it's been press released, it's been talked about, but I think we know from experience, it's actually been very, very hard for our veterans to effectively mesh their veterans' health care benefits with being able to seamlessly go to the community and get their care. If you're from Plentywood, Montana, it can be a 5.5-hour drive to a VA care facility. So I want to make sure that we actually take action to ensure that veterans can go into the community and get care they need so they don't have to drive many, many hours away.
Senator, thank you and welcome to the Senate. It's good to see you this morning. I may be from North Georgia, but issues of ruralness is not new to my district. I have the foothills of the Appalachian Mountains. In fact, I start and Senator King's, it ends. So the Appalachian Trail. So I get the fact that sometimes the distance may be deceiving, even if it's shorter distance, how to get there. And that could be a problem for veterans, especially older veterans. I remember a time in which I had a 90-year-old veteran they were asking him to drive 90 miles to get corrective lenses, and he was having trouble seeing. Not the best position we need to be in. The intent, and I was here for the Mission Act. In fact, I'm going to go a step beyond. Senator Johnny Isaacson was a dear friend of mine, and we got first involved in this. He was a mentor of the Choice Act, which became the Mission Act as we're moving forward, because we saw these very issues that you speak of. For me, it's about making sure that we publicize what is out there. I know that's been a concern for many on both sides of the aisle, is making sure veterans understand the benefits that they have. You and I both know in rural areas, sometimes it's hard to get there. I'm committed to making sure we're using every avenue we can to make sure the benefits that they know about. If they want to use them, great, they'll be there for them, but some do not know. So for you in other states and rural states and even urban settings, we've got to make sure that the access is there. In saying that, it also needs to make sure that the VA itself is not standing in the way, that where there is conditions met, where the precondition met, and they are eligible for community care, it's not the VA that's standing in the way to getting them that health care they need. And that could come through call centers, doctor visits, pre-clearance, and everything else. So we're going to be working with that.
Great. And then as a wounded vet who transitioned out, my wife was also active duty. We served together at the same time. The hardest part about VA care I've found, and most of my peers from the GWAT generation I think agree, is the handoff from active duty health care. The handoff to the VA, unfortunately, I was fortunate enough, I had a fantastic handoff. Disabled American veterans helped with my transition, but very, very few veterans end up in that spot. How can you as the VA Secretary ensure that we have a smoother and seamless handoff from active duty members so when they enter the VA, medical records are ported over, care is ported over, and it happens seamlessly for the veteran?
Senator, as we just discussed, I was previously discussing this in that transition with the chairman and all. It's the most important for the family itself. I think you understand that with your transition, your wife's transition, because at that point there's that unsettledness. Where do we go? How do we get care if we need care, especially if there's a pre-existing or something that's been treated in DOD? How do we get by? There are several things that we need to make sure that our touches are much better. There's been some programs to make sure that we touch, the VA touches on occasions, making sure they get the transition care. If that's not happening, we need to do it better. But there is an issue that we've not discussed yet. I'm sure it's going to come up many more times, and that's the medical health records issue of the VA. That is a program now that has went too many years and cost too many billions of dollars without finding a solution. And my commitment is one of the very first priorities of this, if confirmed, is to get in and figure out why and put this on a bigger time frame to get this medical health records issue solved. I've said this, I'll say this now, and I'll probably say it again. The VA is special, but it's not unique. And hear me when I say that. It's special in who we keep and who we trust and who we take care of, and that is our veteran. But it's not unique in the sense that we do health care. Health care is done in this country every day outside the VA, as well as the largest system, which is the VA. We've got to get our health records straight so that we can have an easy handoff. What should be a simple click of the button is many times taken. I've had in my office when I was in Congress up to almost a year to get those records transferred. That leaves uncertainty for the veteran, that leaves uncertainty for the family, and makes a very unhealthy experience for those that are serving.
Well, thank you, Congressman. Thanks for your service to the country in the war. Thanks for your family service, and thanks for stepping up to serve again.